Hi, I'm Robyn Steward. I have Asperger's syndrome and I work with people on the autistic spectrum, their families and the services that they access. I wanted to tell you a bit about the non-clinical consultancy service which I provide. I recently started providing non-clinical consultancy because I thought it would be a good way of addressing some really important issues. First of all, there are a lot of people who have autistic spectrum disorders but don't have a diagnosis. Secondly, there aren't a great deal of services for people who do have a diagnosis to access. So if you don't have a diagnosis, you can't access services, and if you do have a diagnosis, you may still not be able to access services because the services might not exist. Thirdly, a great number of people on the autistic spectrum have mental health conditions. The National Autistic Society's I Exist 2007 report suggests that 1 in 3 people on the autistic spectrum have a mental health condition due to lack of support. Also, services want to save money, and everybody is experiencing the current economic climate. Non-clinical consultancy aims to make services as autistic friendly as possible for a particular individual and to be able to help that individual to reach their goals. So, as somebody on the autistic spectrum, I would meet you with your key worker or social worker or whoever would be the relevant person. And we would talk about the challenges and difficulties that you experience, and then we would write an action plan. And the action plan involves small steps, not massive ones. The action plan can help you to reach big goals, but the action plan itself has very small aims to reach. But that doesn't mean that those aims aren't going to be a challenge to reach, but it just means that they may well be more manageable, and that's the aim, to provide you with a bit of guidance about how your key worker and you can work together to achieve the goals that you want to achieve.